Do your eyes feel gritty, irritated, or like there's something in them, even when there's nothing there? You might have dry eye syndrome. Dry eye isn't just an annoyance, it can affect your vision, your comfort, and even your ability to wear contact lenses. But here's the good news, there are more treatment options than you probably think. So if you struggle with dry eye disease, then stick around because in this video, I'm going to be speaking with an optometrist, Martin Robinson. Martin's the owner of Martin's Eyecare in Glenorchy, Tasmania. Martin moved from Queensland to the Apple Isle in 2006, and he's been in his current practice location since 2009. He's currently one of only three completely independent eye care practices in southern Tasmania. And in 2022, Martin was the Telstra Best of Business Award winner in the Championing Health category. He is also currently serving as the national president of the Cornea and Contact Lens Society of Australia, and until recently, he was a member of the Optometrist Board of Australia. His practice includes advanced dry eye diagnostic and treatment equipment, such as intense pulse light therapy. And for years, he's been giving patients advice on dry eye management. And that's what we're going to talk about today. But first, who am I? My name's Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that helps independent eye care professionals to grow their practice. So, hello, Martin. Good to see you again.
Thanks, Paul.
So Martin, are you a dry eye sufferer yourself?
Yeah, I have been. Yeah, I've had irritated eyes probably since the mid 90s. And part of that is bad response to misbehavior of me wearing contact lenses when I was young and stupid, which is
And
something that I talk to my patients about all the time, saying, don't be like me, don't do these
mm,
things because these are the consequences later on. And yeah, so most of my problems with my eyes stem from overwear and poor poor management of some of my contact lenses by my optometrist when I was younger. So, and that has had decades and decades worth of impact, and I'm still dealing with it now. And it's something that I don't think you ever get away from dry eye. So it's something that you learn to treat, manage, and control. And manage and control are probably the things that the golden plan, because we can't cure dry eye. We can't make it not exist, but we can make it appear like it's disappeared. Because
right.
the goal of what we're doing when we're treating people is to achieve what they call homeostasis, which means a balance and a perfect zen-like behavior for your tears.
Yeah.
And think of dry eye as being a very anti-zen behavior. Is when everything's wrong and it's out of balance. And you know what that's like with your gut, don't you?
Mm.
When your stomach's well, then you feel really well. If your stomach's out of alignment, nothing's great with the world. So the eyes are
Well,
not that different.
well, I think most people when they start to have some complaints with their eyes, probably the first port of call is to head to the pharmacist and start to check out what the eye drop situation is. But in the case of dry eye, it's like you have to be a little bit careful, don't you? I mean, there are some eye drops that work better than others. So why do some over-the-counter eye drops actually make your dry eye symptoms worse, and how can patients choose the right ones for their specific
Yeah,
condition?
it's a complicated space, and if you've ever been into any pharmacy anywhere, you go to the eye drop section and there's a wall of drops. If you go onto the online shops, there's pages and pages and pages of drops because there's so many different sorts, and people get lost. And if you go into a pharmacy for advice, the thing to sort of remember is the pharmacy assistants that are helping you are, they're not pharmacists often. They can be, but normally they're pharmacy assistants, which have done some small courses, and they've had meetings where sales reps have, given them lunch and talked about their products. So the thing that they'll often suggest most is the one that they had suggested most recently in the last meeting where they had lunch last week. So some companies are very good at pounding the pavement and talking to pharmacy assistants and getting their products front of mind when they're talking to their clients and their customers coming in. The downside to that is some of the companies that are most aggressive in that regard, ones that have got some drops that are really quite bad for dry eye, so that often mask symptoms. And I won't mention brand names, but there are things called vasoconstrictor drugs, which are really commonly used, which are to get rid of redness. and they're really commonly used, and it's an addictive almost process. But the more you use them, the more you change your vessels and the more things are permanently changed in your body. But additionally to that, you think about what happens when you take an antihistamine tablet and you've got allergies and you've got a runny nose. It dries up your nose, doesn't it? So if you put an antihistamine eye drop in the eye, it dries up the eye. So if you've got things wrong and you've put the wrong drop, you're going to make your situation worse, not better. So there are some really lovely eye drops that I tend to use, but I guess I'm a special case because the people that come to see me are already in a bit of trouble. They've already tried a range of products. They've been through the mill and they've tried A, B, C, D, and sometimes people come in with a bag of all their eye drops that they've tried and failed with, and then they bring in one bottle, which is the one that they like at the moment. And other times people come in with a list and they say, like, I've tried all of these and I don't like them, or they're not working for me. So it's a hard thing to say, but I've got some good drops that I would recommend if you were having some dry eye symptoms. There are some drops that are probably a safe bet, and I don't like betting. I don't like gambling with things. I like to look at someone's eyes, assess them, and then give the right drop for them because not everyone's eyes are the same. But there's not much you can do wrong if you chose one of the drops that I'm about to suggest. They'll help most people. And I guess that comes down to preservatives. Preservatives in eye drops and in medicines are there for a reason. And preservatives are there to keep us safe. So pathogens and nasty things don't grow in liquids, which is what eye drops. And that's a sort of important thing. So most eye drops historically have got preservatives, and some of those preservatives can be quite nasty, which is good because that means they kill nasty bugs, but they're also a little bit nasty to the eye, especially if we're using them in a chronic way, if we're using them a lot. So the more you use an eye drop that has a preservative, the more impact it has. So, and often when someone's quite dry, they'll be using eye drops, 5 times a day, 10 times a day, more than that. And that's where preservatives start to really cause problems. So if I want to suggest something that's really safe, it would be a preservative-free eye drop. And how can that be safe? And the idea with preservative-free eye drops, they come in two forms. One is unit dose, so they have little vials or sachets that you can snap the top off, and you can use that eye drop, and you can use that for that day and then throw. And the second way is there are bottles and patented bottle designs that have got filters in them. And these filters allow an eye drop to be sterile inside the bottle and then be safe when it comes out to go into the eye. And they normally have a slightly reduced use by period. And most of those products are about 3 months, but some of them are a shade longer than that, depending on the patented design. So some of these can be in pumps and some of these can be in bottles. So the eye drops that I tend to go for mostly are a product one containing an ingredient called sodium hyaluronate, or HA. And the reason for that is it's a very low salt content lubricant. And we know with dry eye symptoms, it's almost always with an elevated salt level. We call that osmolarity. So high osmolarity is a common feature of dry eyes. So the safest thing you can do is to put a low salt content drop onto that person's eye, because that's going to bring the salt levels down and make it feel better. And the 3 products that come to mind with that, there's an Alcon product called Alcon Sustained Hydration, and it's available in unit dose and it's available in a preservative-free bottle. There is Cadianorm, and Cadianorm is also available in unit dose and also a preservative-free bottle. And both of those products have got their own pros and cons. Both of them have got special ingredients, but they're both worth trying. And I get probably a 50-50 sort of split with my patients. Some are Team Cadianorm, they love that one, and they don't like the other one. And some are Team Sustained Hydration, and they don't like Cadianorm. But those 2 products are the ones that I use most frequently. The third product that I use is a slightly older product, and it's called Hylo or Hylo Fort. And Hylo Fort is non-preserved. It's in a bottle. It's in a pump, and it's PBS available. And it's a fairly convenient, simple product. It's what they call a mono ingredient, so it's got one active ingredient, whereas the other 2 have got multiple ingredients in them. So I like them because they affect the eye in multiple ways. And if we do head-to-head studies with them, they'll often be a bit more effective than just a mono ingredient like Hylo is. But Hylo's cheap and readily available, and the GPs are happy writing scripts for it. You can also get scripts for Cadianorm too, but only for only one of their products comes up on PBS listing.
So all of those product names that you just mentioned, are they all prescription eye drops or some of them non-prescription?
No, they're over the counter, but you can get them on prescription or over the counter, so you can do it both ways. And you've got to do the math on it. Sometimes it's cheaper just to buy it over the counter than to get it on PBS. The difference with that is probably the Hylo Fort ones. They've got they've got a fairly solid deal. With when people get prescribed, they're getting a lot of product. So if you're using a lot of things, well, some patients really love it because they can carry that bottle around and they can use it, ad infinitum because they've got a heap in the pump.
Okay.
And it's
Well,
also commonly found in GP practices as samples on shelves. So if you
right.
go to your GP and talk about dry eye, that's the one they tend to grab because they've always got a freebie to give out.
Okay. So they're fairly well-known products then.
Absolutely, yeah, yeah.
Yeah. Okay. Well, I know that an adage that you're quite fond of is prevention is better than cure. And so I guess that there are some things that maybe we can incorporate into our diet that would sort of, if not prevent, at least sort of like reduce the risks of dry eye or the symptoms of dry eye. And here I'm thinking about things like fish oil and perhaps other like multivitamin supplements. So, like, do you have any advice around those things?
Yeah, absolutely. It comes a little bit down to pharmacy, like saying pharmacy as in pharmacy instead of pharmacy like a drugstore. And it's about eating healthy. Eating healthy, looking after your body is holistic. It's a pillar of wellness to think about, and it does have an impact in terms of dry eye. So if we look after ourselves, we'll do well. What we look at doing for people, but is they might come into me saying, "I'm already doing all these things. I'm a good boy. I'm a good patient. I'm doing all these things. I have a really good diet. I do all this stuff. And is there anything extra we can do?" And that's where the supplements can come in. And if we talk about fish oil or krill oil or omega-3 oils from plant-based things, because not everyone is willing to ingest fish or krill, you can get good high-rich omega-3 oils from flaxseed oil and chia seed oil and things like that. So there is always alternatives for people that are following a vegetarian or a vegan pathway. And with the fish oil ones, you can go along to any chemist and there are multitudes of fish oils. And again, that's a bit like eye drops. It's a bit daunting. There's too many things to choose from. So what I like is I've got a couple of products that we use regularly, and one is called Lacratec and one's called Dry Eye Forte, and they're both similar products to each other, and they're a mixture. So they've got a mixture of very high effectiveness omegas, and they've got some flaxseed oil, and they've got some other vitamin oils in there as well. And one of the things that they've got in them is borage seed oil, and borage seed oil is what they call a switching oil. And the wackiness about borage seed oil is if you ingest omega-6s, and omega-6 oils are really common in the Western diet, so most of us have more than we need of omega-6s. When the body eats them and metabolizes them, they get processed down an inflammatory or pro-inflammatory pathway. So borage seed oil comes along in that metabolism pathway and switches a junction and has the metabolism of omega-6s into an anti-inflammatory pathway, which is the cool thing about it. So by having something like Lacratec and Dry Eye Forte, a patient can take one of those or with a prescribed dose of that, and that it has to be safety protocols with that, but not everyone can take them. You have to check with your doctor and your pharmacist. But you can take those a day, and you're getting high-level omega-3s. You're getting a special oil that is in them that actually helps your body process things in a nicer way to make your body less inflamed in general, and they can be really effective. The other things we can look at are some studies are coming out, and I say studies, so it's not guaranteed, but they're showing really good effect from certain supplements. And one of the things that we talk about is vitamin D has been shown in virtually all patient groups to be effective. If you can take a vitamin D supplement, it's going to help reduce some of your dry eye symptoms. And in Tassie, we're fairly lucky because most of our patients are taking a vitamin D supplement because we don't always get a lot of sun, especially going through winter. So, but certainly it's an easy thing to do, and vitamin D supplements are cheap and they're really available. Some of the other things that are coming up is certainly vitamin B. So I just recommend sometimes a good broad spectrum vitamin B complex, but vitamin B12 in particular has been shown to be helpful for Sjogren's syndrome, which is a condition where people don't have enough tears and have some issues with their mucus productions as well. And the other things that are coming up in terms of studies are talking about gut microbiota as well, and that's an emerging area of study. So there's some good evidence behind it, but there's no amazing products that I can talk about so far, apart from talking about saying that having oral probiotics and oral prebiotics, it can be really helpful. But I've got no massive evidence I can say buy this brand or that brand or things like that. And again, there's lots of those out there as well. So it's a busy space. The other thing, which is I guess something that we figured a little bit about, is hydration. Just something simple like hydration. Recommended daily intake of clear fluids for a man is about 3 litres a day. And for women, it's about 2.5 litres a day, or 2 to 2.5 litres. And I know I would struggle to do 3 litres a day most days. I don't think I drink that much
Yeah,
in
yeah,
clear
me too.
fluids. So, and if we know, when we look at the serum levels and we take blood from dry eye patients, that they've got high salt levels, which indicates they're dehydrated. So again, hydration's a key thing. It's really simple. It just means take more effort, drink more water, and be more proactive with it. And further with the hydration is just being mindful about alcohol consumption. Alcohol consumption is definitely aligned with dry eye symptoms, but it's unusual with its impact between the sexes. So women that even have one drink a week will have an impact on their dry eye symptoms, whereas men can have a drink or two a day and have minimal impact on their dry eye symptoms. So it seems rather unfair, but while you've
Man.
got dry eye symptoms, yeah, the women should probably abstain as much as possible, and guys should be mindful not to overdo it.
Yeah. Well, maybe you can settle an argument for me, and this is to do with fish oils. So I think there are particular fish that are more have more omega oils than others. Like I think it's like mackerels, and I don't know if it's sardines, but there are certain fishes anyway that maybe
I
have
think
more.
there are types of omega-3s which are important, and there's
Yeah.
there's high density and low density ones, and that ratio is there in all fish, but they can
Mm.
extract what they're wanting out of certain fish more efficiently. And
Okay.
I guess that's where the morality of fish oil comes into a bit of a grey area as well, because should we be harvesting a massive amount from the oceans, which are in some level of stress. And I'm also mindful of that with krill, because krill oil is a really good alternative to impacting fish, but only if it's farmed krill. If they're harvesting krill from the oceans, krill are what feed the whales, and that's the bottom of the food chain. Again, I've got some concerns with over harvesting things from the ocean, but again, there are some safe products out there, and most of the ones or the ingredients that are used in the Lacrotec and the Dry Forte are being used from food production. So they're all
Right.
getting oils from stuff that's wasted in the food production areas of farmed salmon and the like.
Right. So the argument was this, that if somebody says, well, I already eat a lot of fish in my diet. I have a lot of salmon and so on. I don't need to take fish oil
Yep.
supplements. Is that true? Do you go along with that? Because I have heard some people say, I've had some people say that you'd need to eat an awful lot of fish in order to get the same level of benefits, and you might actually be like exposing yourself to mercury poisoning along the way. So I don't know if it's true or not.
The therapeutic dose for omega-3 supplementation is about 2,000 milligrams a day, so 2 capsules.
Mm.
So it's a lot. So if we just Google that, 2,000 milligrams of omega-3, you'd have to eat what was from America, so 8 ounces of fatty fish like salmon, and a typical serving size of fish is about 3 ounces. So it's almost 3 servings of
Yeah.
fish per day. So
You'd have to really binge on the
it's a
fish.
fair bit. Yeah, so if you have
Yeah,
fish once a week, you're not cutting it.
yeah,
So you're not
yeah.
getting even close. So
Good.
especially since most fish we would have once a week is probably not high oil fish as well.
Right. Okay, well that settles that one then. So you said that like your journey into dry eye personally was when you started wearing contact lenses. Is that right? So, but I think and you'd know this, like contact lens technology has evolved a lot over the years, and now the contact lenses that are available now are a lot better than they used to be, even for people who have dry eye. So if somebody now has if they haven't used contact lenses for quite a while, what can you tell them about the newer, more modern types of lenses that we have available?
Yeah. A lot of people give up on contact lenses because of dryness or discomfort or something, and it may have happened 5 years ago, or 10 years ago, or 30 years ago, it doesn't matter. But the reality is the technology is evolving really rapidly. And I think back to a meeting I had on the Gold Coast, which was a Contact Lens Society meeting, and I went up there just as an attendee, and it would have been 10 years ago. And at that meeting, I thought, right, I'm going to try and wear contact lenses again. And I got sample contact lenses from half a dozen suppliers in the trade floor, tried them during the conferences. The longest I could keep any of those lenses in my eyes was about an hour, and they were killing me. So it wasn't great for the day. But now I wear contact lenses myself, and I wear them all day. So I had a holiday and did some snorkeling over the Christmas break, and I used my contact lenses going to the beach, and I used them snorkeling. I used them sitting around the pool, and had no discomfort wearing them for an 8-hour day. So there are certain brands of contact lenses that are almost perfectly matched for a drier eye, and there's a few of them that are soft that are like that. And if we go beyond that, we can actually treat really severe dry eye by protecting the eye and shielding the eye from dryness and from any sort of desiccation and damage. And those are called scleral contact lenses, which are giant hard contact lenses that sit on the sclera, which is the white of the eye. So they dome over and above your cornea, so they don't touch the cornea, and they're filled with a non-preserved saline. So your eye's in a perfectly healthy saline bath all day. Doesn't have any lid trauma, doesn't have any blinking, doesn't have any rubbing, and it can almost it's as safe and as good for a really dry eye that it can actually allow stem cells to repopulate in people which have got stem cell failure in their corneas, which is amazing if you keep using them for a period of time. So we can use that for extreme cases, but even someone that's got mild to moderate dry eye, we can match a contact lens that'll make them feel better and make them more comfortable.
Do you do scleral lens fitting in your practice there at Martin's Eyecare?
Yeah, both Adam and myself do scleral fitting. It's sometimes I do find some patients can be a little bit freaked out by the concept of contact lenses in general, and particularly a larger one. So you've got to do a little bit of cajoling and convincing to show people how good it can be. But we've got trial lens sets that we keep in house for hard lenses and soft lenses and scleral lenses as well. As well as that, we can make custom lenses, so we can scan the corneas and we can design something for any particular person. And we do that on a regular basis.
And of course, the other type of contact lens, which you don't wear at all during the day, is the ortho K lens, aren't they? So,
Yeah.
so tell us about ortho K for anyone who's not familiar with it.
So ortho K lens is a hard lens. Its main goal is to change the shape of the cornea. And we know about changing the shape of the cornea because that's what laser surgery is all about. People, known about laser surgery for, 20, 30 years. And laser the front surface of the eye, making it thinner in certain parts, which then makes it bulge or change shape in certain ways. And that can be used to change your focus. But we can do that in a molding fashion with ortho K lens, which have got special shapes to cause bulging and deformation of the cornea in a temporary way. And we achieve that by just wearing them overnight. So you wear them overnight, your cornea changes shape, and then you take them out in the morning, and that changed shape of your eye makes you see better all day.
Yeah.
And the next night you go back and try wear your ortho K lens at night and remold your cornea, and the next day you don't have to wear your contact lenses and don't have to wear your glasses again as well. So it's pretty amazing stuff. And that gets around the dry eye thing because you don't have dry eyes when your eyes are closed. So you put the contact lenses in with some lubricant and they're perfectly fine. You're not then wearing lenses all day, so it sidesteps the problem, I guess.
And I think it might have been you who gave me this analogy, and I think it's a good one. It's like if you've got a ring, like you wear a ring all day, and if you remove your ring, then you can see it's sort of like indentation in the skin because your skin's been molded for that ring. So the cornea kind of has the same effect, isn't it? So the lens molds the cornea overnight.
Absolutely. It's different to wearing a pair of shoes or something like that, but it does change the shape of the eye. Most of things that we think about with clothing, with a ring or whatever, is compression. So it's changing the body by compressing or constricting. And that can happen with, I don't know, tight clothes or a tight pair of jeans or whatever. And you wear that all day, or a tight pair of socks in particular, you get these indentations. The ortho K is even better than that because it's not putting constriction, it's not putting pressure, it's putting negative pressure on. So it causes the eye to change shape with suction, so to speak, and negative pressure, which then causes the eye to vault in a different way. And that's the amazing thing about it. It's not doing anything nasty to the eye. It's not leaving a dent even on the eye in any way. It's changing the shape of the eye in a temporary fashion.
Yeah. And so, like one of the things I've learned about contact lenses is that you have to be very careful around wearing them if you're in water. Like if you're the sort of person who likes to go for a swim, you should be taking your contact lenses out before you do that. But with ortho K, I mean, that's just not even an issue anymore, is it? Because you're completely eyeball
No,
free.
it's not.
Mm.
It's not. The thing that we worry about with water is acanthamoeba. Acanthamoeba is an amoeba that lives in water. And if we look at samples that are taken all over Australia, every freshwater sample, every saltwater sample, every soil sample that's ever been tested in Australia has acanthamoeba.
Even in
they don't treated water.
even in some chlorinated pools that they've found
Yes.
samples of them. Yeah.
Yep. they have an ability to form a cyst. So if they get annoyed, they can form a cyst, and then that cyst can reawaken later. So, and they love the soft tissues of the eye. So the acanthamoeba is the thing that we worry about, and that's the link with water. So what we say is no water with contact lenses. You don't rinse your contact lenses with water. You don't put water in your eye. It's something you've got to be super careful of. And with contact lenses, sometimes, like I was wearing them swimming, but I've got some goggles on, so I'm protecting myself. So limiting that risk. I guess the biggest group that we worry about for acanthamoeba are surfers, because if they're wearing, they don't wear glasses and they don't wear goggles because they fall off, so they often wear contact lenses. And I don't want to stop people surfing, but it's something we've got to be mindful of. If you're looking after a surfer as a patient, you've got to be vigilant and tell them, if you ever get an irritated eye, you come and see me straight away, and you squeeze them into your clinic, because you want to make sure that you screen them, they don't have an acanthamoeba problem. But ortho-K, no problems with acanthamoeba at all.
So maybe if somebody's not quite ready for contact lenses and they want to stick with their glasses, I believe there are things we can do even with glasses. Maybe not these ones, but there are some things that we can do with glasses to actually improve people's dry eye conditions during the day. And here I'm talking about something called moisture chamber glasses. So can you explain what they are?
There's a couple of things that the way to sort of think of it is, everyone's seen safety glasses, yeah? And some safety glasses are fine, but you can get safety goggles too. And the safety goggles sort of seal around your face. And that's often, even guys have had, welding goggles or grinding goggles as well. So dry eye goggles or dry eye sunglasses, the same concept. They're trying to have either a silicon grommet that fits behind, and often in the back of the frame there are little magnets, and the silicon grommet that goes in is just a seal that goes around your eye, a bit like a swimming goggle, but it magnetically attaches to the inside of the frame, and then you can put it on, and it sucks in and keeps the humidity and protects that eye from drying out from air. So if you're really bothered by air conditioning or by heaters or by wind, then you can wear these things and still be active and still use your computer, or you can still be in a room with a heat pump, and your eyes are protected in that space. And in that space, the humidity equalizes as well. And they come in a sunglass version, and they come in an optical version too.
Are they pretty versatile in terms of the range of frames that they work with?
There's certainly not thousands of models, but there's quite a range of models. So we have to have one that'll fit your face. So, and that's important. And there's a range of sizes, and there's a range of colors. So it's not infinite, but there's a good range.
Okay. And so if somebody's using moisture chamber glasses, would they still need to use dry eye drops as well, or it really just depends on
sometimes
the severity?
it really depends on the person. But think of it this way: if you put drops in your eyes and then put the goggles on, then they're going to create a humidity equalization in that space. So, that drop's going to last a lot longer, because it's not going to dry out the same way as it would be if you didn't have them on and you've got air blowing and wind blowing. So I find that particularly with people that ride bikes or ride motorcycles. So when we do the sunglass versions of those, they can ride all day and their eyes don't get really dry, because normally you've got wind blowing on your eyes dry out really fast because you're doing 100 k's an hour on the open road. So and those guys love them. I think they're amazing.
And there are actually like different types of dry eye condition, aren't there? Like there's the what do you call it? Aqueous dry eye.
Yep.
And the other one. And so tell us about, like, would moisture chamber glasses, help for both kinds of dry eye conditions?
It does. If we think about aqueous deficiency, that just means you don't have enough tears.
Yeah.
Then you've got to hang on to what tears you've got. And sometimes that means using supplements, but sometimes it means protecting the eyes as well. So absolutely will help an aqueous sufferer. But the aqueous sufferer would still need to use eye drops. If you've got something like an evaporative dry eye, which is a lack of oil or an imbalance in the oils of the eyes, and those tears evaporate faster, and they're perfect for those goggles because they're stopping that evaporation, they're stopping the wind flow. And I must admit, most of my patients have got a bit of both. They call mixed. So they've got a little bit of aqueous deficiency, they've got a little bit of oil deficiency, and together that's a mixed case. Nearly all of my patients are mixed. It might be, the ratio might be 90-10, like mostly evaporative, but there's almost always a small amount of aqueous deficiency in that person. So we've got to consider both. And the moisture changer goggles are perfect. They help with both.
Okay. Well, also while we're talking about putting things on your eyes, I've heard of heat packs. Well, actually, I've heard this discussion of heat packs or warm compresses. Now they can also have some beneficial effects on dry eye, can't they? Can you tell us a little bit more about those options?
Yeah, I'm almost a little bit heretical when it comes to my philosophy on hot packs, because hot packs and are recommended extensively by all sorts of things. I guess warm compresses are the thing that really we shouldn't be doing.
Mm.
Warm compresses are a face washer, hot water, and you heat it up, fold it up, and put it on the eye. The downside to that is it doesn't stay warm for long enough. At best, it might be a minute, minute and a half, and then you need to have that heat for about 5 minutes to do something worthwhile. So it just doesn't work. Plus, it's tap water that's hot on that face washer, and you're putting that up against the eye, and again that has the risk of that water getting into the eye while you're keeping it closed and lying down for a period of time. So it comes back to that early conversation we had about being careful with tap water. The warm compresses, the microwave pack, so they might be a microwave wheat pack or a microwave rice pack or whatever, and they are able to heat up the eye, so they work well. But there are groups of patients that they don't work for. So I've got a short fuse when it comes to my advice with warm compresses. I say to people, "Are you doing warm compresses?" And they go, "Yep," or hot packs, I should say. And they say, "Yep." Do they help? Do you get any benefit from them? And they go, "Nope." And I said, "Then stop. If it's not working, what are you doing it for? It's a hell of an onus. You've got to go to the microwave. You've got to microwave it. You've got to put it on your eyes. You've got to sit down for 5 minutes or 10 minutes every day or multiple times a day. That's a huge tax on that person's lifestyle. If it's not working, it's not no point doing it. The second thing is if you're a rosacea patient, so people with rosatic vessels on the cheeks or the nose, and you can get ocular rosacea, which is on the eyelids as well, then hot packs like that or warm compresses like that, it doesn't matter which one, they're pro-inflammatory. So they're going to engorge those vessels and they're going to make it worse. So it can make your skin worse and it can make your symptoms of the eyes worse because it increases the inflammation. There are some powered goggles you can get that are, imagine similar to a powered mask, I suppose, and they heat up. And some of them provide humidity, and some of them provide massage as well. And they're reasonably affordable. Like we don't sell any of those, but they're certainly available, and they work quite well. And they're also pro-inflammatory because they're providing heat direct to
Mm.
the skin. So I don't recommend hot packs to anyone with rosacea or ocular rosacea, which is a majority of my patients. And I certainly don't recommend hot packs or warm compresses before I assess their glands on their eye to see if the glands are open and flowing. Because the only time heat works on glands is if the glands are open and flowing. And if the glands are obstructed and there's no flow, like a stasis situation where there's a lack of flow, then heat is useful, but the hot packs you're going to use at home won't get the eyes hot enough. The manipulation you can do to your own eyes to try and clear those blockages is just not effective. That needs help, from a clinician.
So just to step back a little bit and walk us through the science of why, heat actually is beneficial. It's to do with, I think that they're called meibomium glands, aren't they? They're the little oil glands in your eyelid which release helpful oils which sometimes get blocked, and that's what the heat is for, is to unblock those
Yeah.
those blockages, yeah?
Imagine the blockages can be slightly abnormal, more abnormal, very abnormal, and then solid. Each one of those has an increasing temperature of melting. So your meibum is melting at your body temperature. But when it gets a little bit denatured, its melting temperature might increase from, say, 25 degrees, which is about the eyelid temperature, up to 30, and then up to 35, and then up to 40. And with paste, their melting point might be 50 or 60 degrees. And hence the problem, because hot compresses or hot heat packs generally can get your eyes up to about 40, and they shouldn't be treating you or trying to heat you above 40 because of the risk of doing damage to the eye, because the eye starts to be traumatized and cooked, so to speak, at temperatures above 40 degrees. So we want to keep it below 40. But the idea is if you're heating those abnormal meibums up beyond their melting point, then they melt and then they will express and the oils come out, which is what we do in clinic. But trying to get people to do that consistently at home, it's not a perfect science.
Okay, well, Martin, it's always insightful when I chat with you. So lots of good tips that have come out of today. So if you're watching this at home and you've got value out of it, and you're watching on YouTube, don't forget to hit the like button or subscribe to the channel so you can be notified when Martin releases more helpful videos like this one. So how can people get in contact with you, Martin, at Martin's Eyecare?
Well, we've got our website, and there's a booking button, so booking for appointments from there. And there's a lot of great information and data and lots of information pages on the website, which is just www.martinseyecare.com.au. Apart from that, we've got our local phone number, or our phone number, which is 0362 728 423. And if you search for us on Hot Docs, we're on Hot Docs, and you can book appointments from there.
All right. Well, unless you've got something else you'd like to add, Martin, any last words of wisdom, pearls of wisdom?
No, I think that's pretty good.
All right. So thanks very much, everyone. Thanks very much, Martin.
Thanks, mate. Cheers.